veil, right? But
Yes.
thank you, gentlemen, so much.
Yeah.
And moving on, in our next story, the World Health Organization has raised an alarm over an impending shortage of HIV drugs in 8 countries, including Nigeria. Now, the World Health Organization Director General Tedros Ghebreyesus, speaking at a press conference on Monday, cautioned nations like Haiti, Kenya, Ukraine, and others could soon face shortages of life-saving medicines.
8 countries now have substantial disruptions to antiretroviral therapy and will run out of medicines in the coming months. Disruptions to HIV programs could undo 20 years of progress, leading to more than 10 million additional cases of HIV and 3 million HIV-related deaths, more than triple the number of deaths last year.
Now, he has stressed that the funding cut jeopardizes millions of lives and risks undoing almost 2 decades of progress in the fight against HIV. He's also warned that this setback could lead to over 10 million new HIV cases and 3 million HIV-related deaths. I want to take a look at what the populace is saying about this. Emenike says, Nigeria had it coming alongside her sister African countries as listed, ever since the Donald Trump winning by terminating the USAID funding. Africans, it is time to grow up. And Barry Due says, HIV drugs will now cost you 3 million naira for 30 days. 90% of Nigerians will not be able to afford it. With Trump cutting funding for free HIV treatment and other HIV programs, the disease will spread like wildfire. Discipline yourself and save your life. Zip up and wrap up. But I will say this is a chance for the Nigerian government to boost local pharmaceutical funding and strengthen internal healthcare funding as well. Sorry, boost local pharmaceutical production. I mean, in the NAFDAC raids that we've been seeing, so many antiretroviral medicines were found, Ibrahim and Etoma, that turned out to be fake. So even if you can afford these medicines during a shortage, how can you guarantee that you're even getting proper treatment, that the medicine you're using is legit?
That have been affected, but one thing I don't understand is that the Trump administration is trying to erase the gains of 2 decades, 20 years of achievement that they've made in tackling, fighting some of this scourge that is affecting so many people across, on a global level. So it's a wake-up call for Nigeria, for Rwanda, for Ghana, for all of these countries that have been receiving, these donors from the United States. In helping to tackle this situation of ailments and all of that.
Mine is, how much does it cost to produce them right here in Nigeria? How much does it cost to produce them in Africa? Why have we not done? It's 20 years down the line and we are still doing the same thing, getting the drugs from outside. We could produce them right here. So it's a wake-up call. Let's see what happens. The way to go for me is produce them right here.